Hello everyone, my name is Manasnet Klinkul. I am a registered nurse at Atrium Health Hospital in North Carolina. Today I'm going to be presenting my instructional design of the clinical course on discharge planning and transitioning of care for patients with congestive heart failure by using the concept-based learning strategies. Now let's talk about the background. The transition from hospital to home can be challenging as the patient and families become responsible for their care coordination after discharge. Hospital discharge are complicated and often lack of standardization. Patients receive a lot of new information, medications, and follow-up tasks, such as scheduling appointments with primary care providers. The poor transitioning care may increase the risk of readmission and adverse drug events after discharge. Discharge instruction may differ between providers or may not be tailored to the patient's level of health literacy or the current health status. There is a prior studies that have shown that an early discharge preparation process can significantly decrease the hospital length of stay, the readmission risk, and also the mortality risk. I am working in a medical surgical telemetry unit. Most of my patients are admitted due to the cardiovascular disease. They are student nurses who come for clinical practice at all times. One patient outcome that I would like to improve on my unit is to decrease the readmission and mortality rate of my patient who have chronic heart failure. Therefore, the nursing course that I'm designing focuses on the clinical course about the discharge planning, and I'm going to be using the concept-based learning strategy to as the instructional approach. Now we're going to talk about the nursing theory that I would like to focus or apply in my curriculum. The nursing theory that I'm going to be talking about is called the concept-based nursing theory. An important vision that guided the development of this course is the desire to provide the students with the opportunity to practice their nursing skill within real working contexts. So when it comes to teaching strategy in nursing education, the content-based learning or the traditional learning style just can't do the job in today's demanding nursing education anymore. And here's why. The content-based learning hasn't helped the student to learn in a productive way. Some may even argue that it only helped them to be the great memorizers because it focuses on the fact rather than the application, and it relies mostly on the educator instead of the students themselves. On the other hand, the concept-based learning provide opportunities for students to transfer their knowledge into actual practice while developing problem-solving skills. So after you have learned about the concept-based learning theory, I will show you how I integrate this concept learning-based theory into my teaching. So I will use the 3-day methods to teach my students about the concept of heart failure. The student will be given 3 assignments on each day. On day 1, before the clinical day, students are given the pre-work, which is the case scenario for the students to read and think about before they see the real patient. The student will have to have the prior knowledge about the objective assessment, subjective assessment, the diagnosis itself, and how to interpret the lab result. They can open the book, they can do the research, they can find out everything before they go to see the patients on day 2. And so on day 2, it's an observation day where the student will be able to see the patient at the clinical. They can perform the assessment, they can talk to the patient, they can do the hands-on nursing skills, they can teach the patient, provide patients education, and practice on the teach-back technique. The clinical will allow the student and provide them time to research more about the concept in the real life with the real patient. And finally, on day 3, it is the concept analysis day. Students need to complete the concept analysis worksheet, or you can use the concept map, the care plan, or even the reflection assignment. With this assignment, the student can integrate and transfer all the knowledge they have from day 1 and day 2, allowing them to see the big picture and analyze the details that they have been observing from the clinical. The program evaluation is based on the learning outcomes or the learning objectives of this course. The learning objective of this course is that the student will be able to define heart failure and explain physiological basis of the clinical manifestation of heart failure. And also, student will have to educate the patient about the standard pharmacological therapies, condition management, recommended diet, and recommended activities for chronic heart failure. And lastly, the student will be able to evaluate if the patient have understand what they have taught them or not by using the teach-back technique. When the clinical instructor try to evaluate if the students can perform all of this or not, the clinical instructor has to be in the room with the patient and the students when they perform the discharge planning explanation, and also when the student provide education to the patient. So at that time, the clinical instructor will have to check, and normally we can use the checklist form if the students can perform all the tasks or not. Regulatory and accreditation are a form of quality control. The accreditation in nursing education is performed by an accreditation body. It helps control the quality of nursing academic program because the institution with an accredited nursing program will continuously improve their academic quality and have an ongoing evaluation and planning to meet the criteria. This curriculum design follows the American Association of College of Nursing, or AACN, standards. According to the AACN, there are 10 domains which are the core competence of nursing curriculum, and this course meets the criteria in domain number 2, which is the person-centered care, because the learning concept about discharge planning involve patients within multiple complicated contexts, including families. In summary, breaking from the traditional curriculum requires intentional use of innovative instructional design. In this course, the student will be able to build up their knowledge based on concept-based learning strategies. They will be able to design the discharge planning that is specific and individualized to their patient's need. They can also use the teach-back methods to assess the patient's understanding, which will enhance the nurse-patient's communication and relationship.